Good afternoon. I'm really happy to be talking with Lance Luttrell and Breanna Lathrop, who are our experts and the people who are giving maybe the most exciting of the 70 breakout sessions that we'll have next week at the CCHF Conference, Stump the Chumps, which is basically a chance for anybody with any sort of healthcare ministry or healthcare operations problem to come to experts and get a solution. So, Lance, I know a lot about you, but I want you to pretend that nobody knows you because there's always a couple of hundred or more first-time attenders at CCHF. So tell us who you are and what your experiences are and why you think you can answer questions.
Yeah, thanks. Yeah, so I'm Lance Luttrell, based here in Memphis. I've been in the healthcare world for the last 15 years, serving a variety of different roles from chief operating officer to now interim CEO at some of our flagship CCHF organizations. I've helped start a dental residency program, expanded a dental program to 70 sites. Have been able to manage organizations as large as 500 people with significant budgets. And for the past 5 years have been out on my own doing consulting from everything from team building to compliance to solving financial shortcomings, and just finding over and over again that while there's unique flavors of each, we all face a lot of same problems. And so hopeful that we can help answer some of those commonalities as they present themselves at the conference.
Yeah, and just to be clear, Lance, primarily the models, healthcare models that you've worked in have been what?
Yeah, mostly federally qualified health centers. That's for sure the lion's majority of it. But I've done also charitable clinics. I've been supportive of some that, especially some free and charitable dental clinics is where I've done some work as well.
That's great. Okay. Breanna is my boss. She's the chair of the board of directors for CCHF. And also, Breanna, you've got a long history of working in healthcare in a lot of settings. So tell us about your experience.
Sure. So I've been in the free and charitable sector for 17 years or so now. I'm currently the CEO of Good Samaritan Health Center in Atlanta, Georgia. I'm also have been and remain a practicing family nurse practitioner. So I spend about half my time in direct patient care. On the side, I've written a book and I do some consulting specifically around topics of health equity and social determinants of health.
Wow. That's amazing. Yeah, that's great. And tell us the size of the operations of Good Samaritan where you are now.
Sure. Good Samaritan serves just over 7,000 unique individuals a year with a staff of about 55 individuals.
That's great. Okay. Well, both of you have really been doing this sort of work, serving as a consultant, as a helper to people for a long time. You've been preparing, I think, for your talk, I imagine. What sort of questions do you think, Lance, maybe you first, what sort of questions are you expecting? What topics?
Yeah, I think anything from really what I talk about with people when I start with them often is what kind of problems have they been revisiting over and over again that they would like to nail down, or what things feel blurry or, that need to be brought into focus. And so I know that's a bit general, but that can range from things like we're struggling with maintenance issues throughout the organization. When is it time to hire a new maintenance person? All the way to we're struggling to make ends meet with budget. Are there ideas from 340B savings, and how can we fight sort of the manufacturer restrictions for a pharmacy if we don't have our own in-house pharmacy? So anything in that range of that, on the one hand, sort of general strategy, what is the leadership trying to do or management trying to do, down to the nuts and bolts of, specific revenue opportunities, how to use the electronic medical record in ways that might be more advantageous to the organization, or even on the side of what does student and resident engagement look like to train individuals to continue to advance the mission even beyond the current situation.
Yeah, those are a lot of important topics. Breanna, he kind of got to cheat by answering first. Do you have other ideas about some of the questions that people might bring to the breakout session?
Yes, I find that there's often a lot of questions about just the people who work and do this work, right? Everything from HR and how to manage that well, especially as organizations grow and smaller organizations maybe don't have in-house HR. Everything from volunteer management to recruitment of healthcare providers, relationships with specialists and other healthcare systems in the larger network. How do we get what we need for our patients? I also think that, especially in the free and charitable world, there's always questions about fundraising. And we're kind of entering a little bit of kind of an economic space that feels a little unsafe or unfamiliar. And so we're already seeing the effects of that in the communities. So I think there'll be questions about how do we sustain ourselves financially as well.
Yeah. I wonder if both of you, whoever would like to answer first, that's a huge swath of important things. I agree with you. Neither of you mentioned particular Christian aspects of those topics, although I'm sure that those were part of your answers. Like, do you get questions about that? How our Christian faith interacts with the problems and solutions that we're facing?
Yeah, I'd say, I think on the one hand, sort of at we'll call it the floor of the answer would be, what are organizations that receive federal funding allowed to do? And what does that look like? Everything from the selection of board members to CEOs to staff members, like Breanna was saying, just in terms of the people here, what are we allowed to do? What are we not allowed to do? And then even within the realm of what we're allowed to do in the selection of our people, what are best practices with how to actually carry that out in a way that maybe forces the organization to fulfill its full capability of the selection process without becoming a lightning rod for a legal battle unnecessarily. That would be on the floor end of things. I think on the upper end of things, what we're not saying that you're helping us make explicit now is when it comes back to the wisdom that's needed for even those hiring decisions of the facilities manager, how do you do that in a way that honors Jesus and in our clinics? And how can the decisions we do, all of them, from the way we administrate our clinics to the business opportunities we're chasing, how are those reflective of the kingdom of God and his values? So I think those would be woven in certainly to the responses and appreciating the questions from the group that would come from that perspective.
Yeah. Breanna, do you have any other input? That's a great answer.
It is a great answer. And I agree with Lance that it's about how do we think about our mission and the why behind what we do and all of those levels of decision making. And I think beyond that, it's also that as we continue to grow, as kind of long-term leaders step down and new leaders emerge, how do we make sure that vision and mission continues throughout the organization? And that's a day in and day out process of what builds a culture around honoring Jesus and the work that we do.
Wow. Listen, thank you both for talking with us. I am going to be in the front row for the session, and I'm really looking forward to Stump the Chumps at the CCHF Conference just in a week or so from now. Thank you both for talking with me.
Thank you.
Thanks.